at least twice its normal thickness. The depolarizing voltage generated in the enlarged right ventricular muscle mass can produce abnormally tall R waves in the right-sided chest leads and persistent large S waves in those on the left. In fact, an R wave in lead V1 higher than 7 small squares in amplitude, as illustrated in the example shown here, is highly suggestive of the presence of underlying RVH. Equally, if the R wave in lead V1 is higher in amplitude than the S wave in that lead, this is also strongly suggestive of underlying hypertrophy. The ECG shown here is from a patient with chronic pulmonary hypertension. Again, we would invite you to stop the video at this point and analyze the changes present. You'll notice the prominent R waves in the right-sided chest leads and significant S wave activity in those on the left. When we examine lead V1, we find that the R wave is 2 large squares in amplitude, or 10 small squares, well above our To complete our brief discussion of the ECG changes associated with RVH, it is worth mentioning that although there are other causes of a dominant R wave in lead V1 unrelated to hypertrophy, the V1 R wave voltage criteria we've just applied to this ECG have reasonable specificity. However, as for LVH, the sensitivity of the ECG in the diagnosis of RVH is poor. In fact, it is only possible to diagnose about 1/5 of RVH cases from ECG changes alone.